you look at this. These are the states with the highest drug overdose rates, listed as deaths per 100,000 of the population in those states. Just look at that. West Virginia, New Hampshire, Kentucky, Ohio, Rhode Island, dreadful numbers there. And we have a study, and it says doctors who attended, quote, lower tier medical schools, whatever that means, they prescribe far more opioids. Dr. Marc Siegel is here. That's a slam on so-called second-tier med schools, isn't it?
Yes, let's start from that. I looked at the study carefully. It's from Princeton Economics. It's accurate. And really, they use Harvard as their benchmark. Harvard, which is the top medical school in the country, an average doctor prescribes less than 100 opioids a year. Lower-tier medical schools ranked in the bottom of medical schools around the country, 300 per year. And get this, general practitioners, whereas, Stuart, over 50% of all opioid prescriptions are written by family doctors. I have a gripe with that because a lot of times they're treating something they don't even know. They're not even pain experts. Listen to this. Harvard, 180 approximately on their family practitioners per year of opioids. Yeah. Around the country, lower medical schools, 550.
Is that
550, so 3 times as many prescriptions for opioids written by general practitioners outside of a top school like Harvard.
Well, if you went to a top school like Harvard or to a New York college, a medical school, you probably have a clientele that is wealthier than the second-tier doctors who didn't go to Harvard, and maybe that accounts for some of the difference in opioid prescriptions.
So your training at the London School of Economics is coming in here, but they thought of that too. Princeton may not be as good as where you went, but it ain't bad, and they thought of that. They factored that out. It is not a socioeconomic problem. It is a real finding. They found this for all socioeconomic levels, this held true. But you know what this is? It's a wake-up call for more education. And I know you don't like the word mandatory, but I just took a mandatory education course in New York State for licensure, which is now, you have to have it, on opioids, and it focuses on the word exposure. How long are you on opioids? You just had your teeth out? Did you get 2 days prescription? Did you get 30 days prescription? You had surgery. Did they give you 120 pills and said, call me in the morning? You know, or did they actually treat the problem? That's what they're teaching us now. So even if you went to a lower-tier medical school, the problem can be compensated for now. You need specialty training. We need to know what we were doing. We were taught about pain, but we weren't taught how to treat it, so we threw opioids. Doctors are the problem here. I'm very judicious. I hardly ever prescribe them.
Okay, I was encouraged by Express Scripts, which yesterday said, you prescribe opioids, you get 7 days supply, that's it, that's all you get. That, I think, will help. Last word to you.
Huge idea. That's already the law in Maine. We have, as you pointed out at the beginning, there are some states that are worse than others. You know, the head of the FDA, Gottlieb, who we've talked about on the program, is very into this idea of limiting duration. Yes. So that Express Scripts idea is going to become more and more prominent.
Well, it's a terrible problem, and it's good to see it being addressed.
At the beginning, as prevention.
Yes, sir. Thank you.